Hello again, this is Dr. Jon and Katie at Pro Chiropractic, and we're actually in our PT clinic, Pro Physio, sister clinic, where we have licensed physical therapists and physical therapy assistants that work hand in hand with the chiropractor. So we decided to come over here and use this space to demonstrate some chiropractic adjusting. And so today with Katie, we're going to work on her thoracic spine. The thoracic spine is the mid-back spine, so it's where the neck stops and before the low back starts. So kind of between our shoulder blades, we would call the thoracic spine. So we've adjusted Katie 1,000 times over the last 15 years. And I'm just gonna kind of show you some of the typical approaches, and then we'll end with one that is not so normal to see at a chiropractic office, but I like to use, that's really comfortable for the patient and easy on the doctor as well. So normally for a thoracic adjustment, we'd have the patient lay face down. So go ahead and lay face down, Katie. And so the chiropractor, make sure you're centered nicely on the table. We're aware that the thoracic spine has a kyphosis. That means it curves like this, sort of like a baby in fetal position. When we learn to hold our heads up, we get this curve in our neck called the lordosis. And when we learn to walk, we get this curve called the lordosis in the low back as well. But the thoracic or mid-back spine stays curved like this. And when we're adjusting the spine, we're using palpation, that's our hands and fingers, to press into the area, and we become really expert at knowing where the spine is moving as it should and where it isn't. So just static palpation, that's where I'm just moving my hands on her. We can feel, or I can feel, areas that it feels almost kind of mushy. And that's where it's a little bit inflamed, and that's usually where it's locked. And then we can also use motion, where I'm springing into her spine and finding these areas. For instance, when we come up here, it moves a little better. When I come down here, you feel the difference, Katie?
Yes.
Yeah, not so much there. And then she's definitely a little blocked in the lower thoracic spine. So even right now, I'm assessing and finding areas. Now, the normal approach would be to have her breathe in and out, and I would apply a thrust in the right angle to push those bones in the right position. So that's one approach for thoracic adjusting, but we're not going to use that one today. We'll show a couple others and end with one and actually do the adjustment. So turn on your back, Katie. So that last one would have been what we call a back to front, or P to A, posterior to anterior adjustment. We can also do it anterior to posterior. So with this, we have the patient kind of hug, which opens up the mid-back. We would have already assessed and then used my hand on the spine. We would push her back and in the right angle, use her own momentum and body weight to gently lay her on my hand and push those bones forward into the right position. But we're not going to do that one. What we are going to use is what I call the foam roll of goodness. Okay, so for this we just use a foam roller, and I'm going to come on this side here, okay? So I'll have you sit straight up, Katie. Keep those legs right in front of you. So instead of my hand, we're using the foam roller. And we're going to lay her on a certain section of the foam roller that's actually more specific than my hand. I'll have Katie put her arms up just like this. Important here not to clench the fingers behind the neck, because we don't want to torque the neck down. We want her to bring her elbows slightly together. Take a big breath in, relax those elbows, and then blow that breath out. I'm going to lean her back on the roll, supporting her head, and just pressing back. And then again, and back. Good. One more here, and then all the way, and let it go, Katie. There, we got a little. So that is the P to A foam roll chiropractic adjustment. And this is Jon and Katie with Pro Chiropractic. Thanks for watching.